Hi everybody, this is Dr. A. For our basics of urinalysis, we're going to look at the types of urine specimens and then things that can contaminate urine specimens. Alright, first, the random specimen. It can be collected at any time of the day. It is the most common type of specimen collected for tests to be performed on. If you think about patients showing up to the ER to, be assessed and they want to run a urinalysis, it would obviously have to be a random specimen because people go to the ER at random times of the day. The disadvantage of a random specimen is they're often dilute, have low concentrations of the solutes. It is easy to miss the pathological metabolites, and diet can affect the results. So what they've been eating can affect those results. The first morning specimen is collected in the morning upon arising from bed. So when a person gets up, that first amount of urine to leave that bladder, that's the specimen that's collected. So it's a more concentrated specimen. It is preferred for all urinalysis testing if that's possible to obtain. Pregnancy testing should be performed with this type of specimen. A lower pH is typical, and specific gravity tends to be higher because it's more concentrated urine. And it's been sitting in the bladder all night too, so maybe the lower pH is tied to that. Also, at night when you're sleeping, your body's doing a lot of maintenance, and so that could also be tied to the lower pH of that first morning urine. The best specimen to detect UTIs is a first morning specimen because of that longer time of the urine in the bladder, and the bacteria then can accumulate more and it'll be easier to detect. It is usually a fasting specimen, and so that can also facilitate the detection of diabetes. But of course, you can't do a first morning specimen on somebody that is in the ER, for example. You could do a first morning specimen on somebody that is inpatient at the hospital, or you can send a specimen collection cup home with a patient with orders to collect the first morning specimen and then bring it right away to the clinic or the lab. The 2-hour postprandial specimen. It's a specimen that's collected 2 hours after eating a meal, and so this could be used to detect glycosuria, so urine glucose, and that could be suggestive of diabetes. So if 2 hours after a person has eaten, their sugar in the urine is still elevated, and that could indicate the person metabolizes those carbohydrates right and has diabetes. One of the key for this to be accurate is the patient must void or empty their bladder before eating their meal for that test to be valid. So it would be, therefore, the urine that's produced is the urine that is produced during the meal and post-meal, and that 2-hour window from the time of the meal till the time of the collection of the specimen. A 24-hour specimen, it's a urine specimen that's collected under a strict time regimen in order to detect certain solutes because of diurnal variation. So it's a big 24-hour window. So we can start this at any time. We just have to go for 24 hours. So if it was started at 4 o'clock in the afternoon, then it would run until 4 o'clock the next afternoon. There are very explicit instructions that a patient has to stick to, things such as you want them to completely empty their bladder before you start the time clock so that you know that everything is collected from then on is in that 24-hour window. Every urine that is produced needs to be collected, so nothing needs to be discarded. The containers are usually really big, and sometimes patients, if they're producing a lot of urine, might need several containers. And the amount of the volume of specimen is also something that's measured with a 24-hour urine specimen. Sometimes there's certain instructions like the specimen should be kept on ice or kept refrigerated. Anyway, so that is a 24-hour specimen. Next is a catheterized specimen. It is employed to collect a urine specimen for microbiology testing and also to measure the excretory function of an individual's kidney or when a patient is unable to void or use the bathroom. An example of when a patient would be unable to void, it would be a male with a swollen prostate and they can't, they cannot empty their bladder. And so a catheter can be basically pushed through and pushed kind of past that swollen prostate, and that allows that urine to be drained from the bladder. If they're bedbound, sometimes ICU patients will have an indwelling catheter, and then it will measure the amount of urine that's being produced during the day, during the night, and all that is logged, and that can help assess individuals' kidney function. If the one for the microbiology testing is usually what we call an in and out cath, and it's when you want to make sure that you get urine that's straight from the bladder and hasn't been contaminated by bacteria from the labia, etc. So the disadvantage of a catheterized specimen is it's not really comfortable for the patient, and you do have a risk of infecting the bladder, because whenever you push the catheter in, if you don't clean the site properly, the catheter could pick up bacteria and it can be introduced straight into the bladder, and so that could be a problem. The suprapubic specimen, it is collected externally by introducing needle into a bladder, so that is definitely not comfortable either. The patients are usually infants, elderly, or women. The advantages is that it would be collected under sterile conditions, so it's a specimen that's suitable for microbiology testing, and also for locating the source of a UTI in women if there's a big risk of vaginal contamination. The disadvantages, of course, is discomfort to the patient and risk of infecting the bladder, also same as the catheter. Whenever you invade a space, there's always the risk of introducing bacteria in that procedure. Next is the midstream clean catch specimen. So this is the best alternative to the catheterized specimen. The procedure says that the patient must clean the meatus, which is the opening of the urethra, with towelettes, which are little wipes. And the male, you have to retract the foreskin. They have to retract the foreskin and clean. Females, you have to make sure that the wipe through the, across, well, down the labia, really good. Clean the labia really good. So trying to basically decontaminate the exit, if you will. And then the patient voids start peeing, and the first portion of the urine goes into the toilet, and then so then like midstream, so first a little bit goes into the toilet, put the cup and start collecting the urine. So that the cleaning plus like discarding that first little part should limit the contamination of the specimen from skin bacteria. So obviously for that you also want to use a clean, sterile container. And this type of urine specimen is ideal for sediment evaluation and microscopic studies, and for it's really good for detecting your UTIs, urinalysis, urines that are contaminated with bacteria. So whether that is coming from the bladder or the kidneys, either way, UTI detection, especially at the clinics or in the ERs, where you really don't want to, again, due to catheterization, if possible, avoid that. So what are the sources of contamination in urine specimens? So menstrual blood, it can produce a false positive for the blood and the protein test, of course, and the presence of blood could mislead the tech into thinking there's something more going on other than simply a normal period. Vaginal secretions, that could cause an increased number of epithelial cells, and that could obscure the other sediment components such as bacteria. The mucus could be present from the vaginal secretions. It could be mistaken for hyaline or hyaline cast. So, for the menstrual blood, if the blood flow is pretty heavy, this could be an instance where an catheter might be the better option to get accurate testing. If the flow is not too heavy, then a midstream clean catch should be able to do the trick. And then lastly, fecal material. This can be identified by the presence of undigested plant and animal tissues. So they're quite odd looking, but they don't belong in urine. So when those are seen in urine, they're indicative that there's fecal contamination. It is indicative of one of three things: either careless bathroom technique or uncleanness, so improper wiping or no cleaning, no wiping. Falsifying urine specimens by substituting commode water. That's possible, especially if they think you're testing for drugs. And vesicosigmoid fistula, which is an unnatural opening between a colon and a urinary bladder. And the urine is likely to have a brown color, many bacteria, and colored urinary components and fecal odor. So that is a possibility. So that's a true pathology for sure and needs to be detected. And that wraps up our specimens for urinalysis. Thank you.